This is my case study of the adolescent patient. My patient's name is Cara Bailey, and she is 17. She is in the 12th grade and is homeschooled. Her guardians are her mother and father, and she has obsessive-compulsive disorder. She enjoys listening to music and meditating, sometimes with white noise, and she also likes going for runs and painting. Most people think OCD is just having to have things perfect or orderly, but that's not what OCD is at all. OCD is related to anxiety and depression, and it is a psychological disorder. People with OCD can experience disturbing thoughts, which are considered the obsessive component to this disorder, and repetitive tasks, which is the compulsive aspect of OCD. They might use rituals to decrease stress and anxiety, and these are only done to lower the levels of stress in the individual. They also might experience disturbing, intrusive thoughts and images. Cara did not want to go into too much detail about what she experiences on a daily basis with OCD, but she did allow me to know some of the things she does that could affect her oral health and dentition. OCD can be debilitating for an individual and interfere with their quality of life. It can begin in childhood and progress throughout adulthood. Some ways OCD can develop is through being inherited through family member to family member, through genetics, neurological brain dysfunction, or through gastrointestinal etiology, which would come from gastrointestinal microbes influencing inflammation within the GI system, and immunological effects, which then influence disorders in the brain such as depression, OCD, and many others. The World Health Organization named OCD one of the 10 most disabling mental health disorders. Her family does have a history of anxiety, depression, and OCD. She recently started a medication called Celexa, which is a selective serotonin reuptake inhibitor. She was alert throughout the entire appointment and seemed to comprehend all of the oral hygiene instructions I gave her. She did ask a lot of questions and wanted to know details about every step of the appointment. I would say Cara's nutritional status is of concern, as she said that she almost never finishes meals due to fear of contamination. She said that almost always she has to stop eating her food because she starts thinking about bacteria being in her food, or someone touching it and just can't finish it. When we talked about what she eats on a daily basis, it does not sound like Cara is getting a whole lot of protein in her diet. It is also a concern that no matter how hungry Cara is, she only allows herself to eat a certain number of certain foods. Her nutritional status will be talked more about later. The vitals at this appointment were all normal except her blood pressure, which was prehypertensive. When I asked if this was normal for her, she stated that she is always anxious about going to the dentist or doctor, so she said this does seem normal for her. She did not have any hearing or vision problems or anything like that throughout this entire appointment. So the SSRI, like Cara is on, which is the Celexa, along with antidepressants and cognitive behavioral therapy, have all been found to be effective in those with OCD. Side effects of Celexa that may affect Cara and may affect her dental appointment include xerostomia, abnormal taste, possibly impairing platelet coagulation, which could increase bleeding. Taking NSAIDs while on this medication can also exacerbate bleeding. Insomnia, drowsiness, and nausea. So we know that nutrition does directly impact oral health, and some of the things that may impact the nutritional status of this patient is not eating fresh fruits and vegetables because she fears pesticides and insects in food. She will consume canned and packaged fruits and vegetables only if the vegetables are heated for a certain amount of time. And most of what the patient consumes is prepackaged snack items and candies. She can only eat a certain number of items, and it doesn't sound like she's getting enough protein in her diet. Some of Cara's favorite drinks and foods that she eats on a daily basis includes Baja Mountain Dew, macaroni and cheese, ramen noodles, frozen waffles with syrup, grilled cheese, Oreos, and Cheetos. The only meat she will eat is usually pepperoni on pizza, and sometimes she will eat chicken nuggets as long as they have been heated for a really long time. She did tell me that she likes to snack on different candies like Swedish fish and gummy worms and chocolate sometimes throughout the day. This of course raises the amount of sugar and sodium she is receiving throughout the day. We all know that a high-carb diet can increase risk for periodontal disease and caries. Constantly eating carbs and sugary foods throughout the day, like Kara does, can increase plaque formation and the demineralization of tooth structure, leading to decay. We also know that protein is such a crucial component in maintaining healthy periodontal structure. Since OCD is a psychological disorder, there aren't strict contraindications or things you really couldn't do during an appointment with a patient that has OCD unless they are just uncomfortable with something. There are some precautions that should be taken just to make the appointment better and less stressful so that nothing goes wrong during these individuals' appointments. If a patient with OCD is on a medication, it is possible that they will have increased bleeding, so just make sure the bleeding is stopping as you work. Most patients with OCD will be anxious of dental appointments strictly from the fear that dental offices are not clean, or there is cross-contaminations, or procedures are not done with properly sterilized equipment. Any kind of stress during an appointment could possibly lead to higher blood pressure. As stated, Kara's blood pressure was already pre-hypertensive within the first 5 minutes of her appointment, so I definitely didn't want to add to any of her anxiousness and possibly increase her blood pressure any further. Even with Kara on a medication to calm the effects that come along with this disorder, her anxiousness still led to higher blood pressure, which could be a problem, especially for patients that aren't on any medications for this disorder. It is also important to know that this increased stress could lead to overthinking and increased compulsions in an attempt to calm this nervousness. This could cause an individual to cancel their appointments due to fear that they will either get to the office and get stuck in a compulsion, or be late or miss their appointment altogether from being stuck in a compulsion. Some things I did to decrease Kara's anxieties about contamination were letting her see me wash my hands after putting all my stuff on and not touching anything else before I put on gloves. I also explained how we sterilize our instruments and how we clean everything before the appointment. It can also help to schedule patients with OCD first thing in the morning, because if these patients have appointments later in the day, they might be worried and think about it until they end up just canceling their appointment altogether. Many things that are associated with OCD can affect the periodontium. Anxiety can cause increased inflammation, which could cause gingivitis and lead to periodontal disease. Depression could cause lack of oral hygiene care at home, which could also lead to increased caries and periodontal disease. Medications for OCD can cause xerostomia, which we all know can increase the rate of caries. Lack of vitamins can cause decreased antioxidation and increased inflammation and infections within the periodontium. Also, as talked about earlier, eating high carb and sugary foods instead of non-cariogenic foods on a daily basis can lead to increased caries. Many with OCD spend a lot of time doing their compulsions and dealing with their obsessive behaviors, which can lead to a neglect in their overall oral health and lack of nutrition. Kara's mom stated that her last dental visit and cleaning was about 2 years ago. Kara's chief complaint for this appointment was that she had sensitive teeth and sore gums. Her intra-extraoral exam included bilateral jaw pain, the gingiva was dark pink, stippled, and firm. She had generalized recession on her posteriors and localized inflammation on her anterior papilla. She had generalized demineralization or white spots and abrasion and wear facets on her posteriors and attrition on most of her anterior teeth. Her occlusion was a class 2 with a tendency to class 3. I did feel bilateral crepitation and asked her if she ever has jaw pain, and she said that she occasionally does have jaw pain on both sides. I asked her if she ever grinds her teeth, and she said that she does. She thinks she grinds her teeth without even realizing she's doing it sometimes. She has never had orthodontic treatment, and she does not have any removable oral appliances. Kara's mom said that she received a panoramic x-ray about 2 years ago at her last dental visit, so we only updated her bite wings at this appointment. Here is her dental chart, and we did do a full perio chart. Based on her radiographs, all of her wisdom teeth are unerupted. She has had some posterior restorations and one anterior restoration. There was some BOP when completing her perio charting. I did get a few 4s when probing. With added recession in some areas, the clinical attachment loss were 5 and 6 millimeters. She was classified as an A0*B. Kara's chief complaints of tooth sensitivity are likely from attrition and recession, and her sore gums are likely due to brushing too hard with a medium bristle toothbrush and having to brush a certain amount of times until Kara feels at ease. She said that sometimes she has to brush between 20 or 30 times on each side of her mouth. No lesions or indications of major infection or anything of major concern was found during her appointment. The main concerns included the recession and demineralization. Most of her plaque was found on the buccals of her maxillary posteriors. There were 3 spots of calculus found on the distals of 2, 15, and 18. On top of grinding her teeth, she said that she also taps her teeth together a certain amount of times throughout the day. She said that she does this especially when she is counting something in her head. Her tonsils were within normal limits. She said she brushes in the morning, after every meal and snack, and before bed, and flosses once a day. She also constantly uses floss picks throughout the day, but when she showed me how she flosses, she did not seem that she knew how to use the C-shaped method when she was flossing. And she also flossed just in between each tooth without actually going all the way to the gum line. She uses a medium bristle toothbrush with a fluoride toothpaste, floss picks, and a mouthwash that does contain alcohol. Here are her risk assessments. She is at a high risk for caries and at a moderate risk for the progression of periodontal disease. She does not have any issues brushing her own teeth. She often fears that she has not brushed her teeth enough or forgets how many times she has brushed each side of her mouth and will actually start over. Individuals with OCD can experience depression. Kara said that she does have days like this, but she never stops her home care routine. Her PHP score was a 0.8, which is good. For oral hygiene instruction, I taught her the Bass technique and C-shaped flossing and explained the benefit of fluoride and how it can help with her tooth sensitivity due to recession and prevent against demineralization and caries. I also recommended a soft bristle toothbrush and an electric toothbrush to help her keep track of all that she has brushed and allow her to see if she is brushing too hard with the pressure sensor on the electric toothbrush. I recommended that she get a fluoridated mouth rinse that contains no alcohol and explained that alcohol can actually dry out her gums. I also explained that she should wait 30 minutes before and after eating or drinking to brush her teeth because this can be abrasive. During this appointment, I hand-scaled the spots of calculus, and I also irrigated the spots where her probing depths were deeper with the ultrasonic. She was a little sensitive to the ultrasonic at first, so I turned the power all the way down just to allow irrigation of the gingival pockets. I polished her restorations with toothpaste and then polished all of her other teeth with a fine paste, and then used the fluoride varnish. Here are all of the sources I used. Thank you!